on, we've seen Kenyans leaving the country because they would like to pursue or seek greener pastures. What's your take on that? Because most of the European countries and the countries in the West were taking advantage of that. Best doctors first. They were actually picking them. So talk to us a little bit about brain drain.
I think what what causes this is the lack of appreciation by the government of Kenya when we have doctors. Because we realize, as I said, that some of the things we are going on strike to, you go on strike to be promoted, you go on strike to get your salary, you go on strike to be posted as an intern, you go on strike to actually get equipments and drugs in the hospital to serve the patients. So you realize that you are not supported to offer the roles or to see the patients as expected. So most of the times you realize that it's better to go abroad where this is actually offered. You, as a doctor in the hospital, you have everything to do to the patient. That's one thing. The other aspect is the green pasture wages. You are getting paid here less wages compared to what you're paid abroad. So that makes it easier for you to go. And you feel appreciated when the wages are better. The other thing that we've seen government doing is the G2G agreement, for example, with the UK.
What's G2G agreement?
It's government-to-government agreement, where they have an agreement to have a particular number of health workers that are being exported to the different to UK. What that means is that it gives government some revenue. So you see, I think there are quite a number of nurses that have been going, that doctors also are moving out of the country, but we have a shortage in our country. So on one side it gets revenue for the government. On the other side, it also gives these doctors or these nurses job opportunities, but on the overall pictures, it makes us not get access to healthcare. Why am I saying this? Because we have shortage, and there's no way you can have access to healthcare without actually employing. So we need to balance really, and we need to create an environment that will make health workers be appreciated and get to our services.
I know it may not be very obvious now, but 10, 20 years from now, what will this brain drain have done for our medical sector as a nation in general?
You know, we have a big shortage of nurses in the country, over 100,000. We have a shortage of doctors of about 50,000. So if we are training just 1,000 and we are not employing them, and then they try to get experience, immediately they become good or they specialize, they leave the country. It means that you are left with a dysfunctional healthcare. This is the typical example we have in Nigeria, where Nigeria has a registered number of about 75,000 doctors, but those who are working in Nigeria about 25,000 against a population of 200 million. So the healthcare is in shambles. It's dysfunctional.
Just in Kenya or Africa in general?
Yeah. Or Africa in general,
as an example,
but Nigeria is the highest example because also of the low wages, the difficult working condition, which is almost like ours, where you have to, at least here we are striking to demand for functional public health care. See, we were the first doctors union across Africa to actually say, no, forget about being elitist. We are workers first. We have to have a functional hospital. So the strike is actually for the government, for the Kenyans.
Yeah, I know there's, we don't have much time, but if you are the CS today,
yes,
for health, what would you do differently to make sure that you meet the needs of the doctors?
There will be no strike, and I'm saying that because we are seeing that the strike that we are on now is highly castigated because of the non-responsiveness of the ministry or their contravening of the collective bargaining agreement. When RCBA is signed, any person globally, because Kenya, it's under ILO Convention 98 that Kenya ratified, is part of our constitution. You can't be a cabinet secretary who first role in office is to violate this. Because our first statement when she was interviewed in media, in Jeff Koinange Live in November 2022, she was complaining about how much interns were earning. And therefore she planned and send a letter to SRC, which then reduce the salaries that has been negotiated by 90%.
But Doctor, is this a single mind at work or it's collective? She's just the mouthpiece.
I mean, you must take responsibility as a person in charge. Yes, you may have the technical persons and every person, but you make the decision. You write the letters. You actually advise even the executive on matters healthcare. And therefore, every decision that you make should be well informed. If it is the technical persons that are not giving you the right advice, then you should fire them.
Daktari, tuambie, strike itaisha, nini kifanyika?
Number one is that, as I said, we are not on strike. It's the government on strike and we join them. They'll be there for 7 years. We are just on 34 days. So if we don't meet with government to have a discussion on the issues that we presented, we are ready to go for another 100
So
days.
you're open for talks?
we are more than open for talks. But if we don't have talks, if we just get this threat, suspend the strike will continue for 100 days, 200 days, for a year. So it is upon the government now to meet us and have a discussion. Our issues are very simple. What do you want? We want the implementation of the CBA. What does that entail? That these hospitals will have enough drugs for patients to visit, that these hospitals will have equipment that are functional, that we have more doctors employed so that patients do not have long waiting hours in the hospitals, that we have the salaries and wages that we agreed are respected. So basically it is more of public health care than pro-doctor issue. Yeah.
Daktari has said that it's not the doctors on strike, it's the government on strike because they have an agreement and that agreement has not been met. Thank you so much for creating time to be here with us. We don't know whether to say bado mapambano ama we don't know what to say.
Solidarity.
Really. Yeah, solidarity maybe to the doctors. Lakini pia patients wanaumia. Daktari, please angalieni hiyo pia. Sawa sawa. Asante.